Hello and welcome to this yoga class for backache during pregnancy. So my name is Bettina Ray. It's an honor to share this practice with you. And before we get started, I just want to let you know this class isn't for you if you've got SI pain, so instability in the pelvis, or if you've got sciatica pain. I have specific classes for those two conditions in the studio, so go and check those out. You can start your free 30-day trial at any time. And also make sure you subscribe to my YouTube channel if you're watching this on YouTube so that you get all of my free videos as soon as they come out. So in today's class, I just want to show you briefly some of the alignment issues that can cause that backache at the end of a long day when you're pregnant, and some of the poses that you can do to relieve some of that pain. So we're going to start in what is a typical pregnancy yoga pose, and it's our cat-cow. So bring the knees under the hips and the hands under the shoulders. And I want you to release through the belly. So just let it all go soft and just kind of find where your body slumps to. And then I want you to draw the tailbone slightly down and draw the core in. And so notice that the pelvis kind of tilts slightly. Find where it feels good. So where that pain in the back is eased through the tilting of the pelvis. I'm going to try and apply that in our other poses and how we stand normally. So that will help to ease some of the pain that you're feeling, just getting that pelvic tilt right throughout your day. So from here, press into the hands, lift the tail, lift the head. And then exhale out through the mouth, look back towards the thighs. Inhale to rise. Nice and slow, exhale out through the mouth. Inhale and exhale. So take those knees nice and wide so you've got room for your belly. Take a seat back towards the heels, stretch the arms forward. Take the forehead down. Just soften here in child's pose. Maybe even take a rock from side to side. Then walk the hands over to the left side. Take the right on top of the left and then soften the head and neck once more. Anchor back towards the heels, so nice stretch through the right side of the body. And then inhale all the way over to the opposite side. Left hand on top of right, and then rest and soften down. Inhale, coming back up. Come back up onto the knees, step the left foot forward. Walk it into the midline of the body, and then draw the toes back towards you. Inhale, lift through the heart, and then exhale to soften a little bit more. So you notice that my knee is bent here. It doesn't need to be completely straight. You just need to be able to feel the stretch in that hamstring. Often our lower back issues are due to really tight legs. And as your belly grows and the weight that you're carrying around every day increases, you're increasing the strain to the legs. So stretching them out can help to relieve that pain as well. So you can soften the head and neck down. Bringing the weight into that back knee as much as possible. And then inhale, coming forward, leaning into the opposite hip. So bringing a little bit of space into the right hip. If it's okay for you, you can come up onto the thigh and just gently press in to lift the chest up. And then bring the hands back down to the floor. Left hand to the floor. We're twisting away from that front leg. Inhale, reach the arm up. And see if you can keep this knee glued to the outside of this arm. So we're keeping the inner thighs engaged. The legs are almost drawing in together. So we support the back there with the power of the legs. And then exhale, lower it down. Let's swap sides. So take that left leg back. If it feels good, take a bit of a brief circle just to reset through the hips and the back. And then step that right foot forward. So walk that foot into the midline and then draw the toes back towards you. And see if you can fold and soften over the leg. Release through the head and neck. Inhale, bring the weight back into the front foot. Lift through the chest and feel the stretch in this hip. If it's okay for you, come up onto the thigh. Inhale. So in this pose, we bring the weight into the front foot so that we're really stretching through this hip. And then bring the right hand down inside that right foot, glue the knee to the outside, and inhale the arm open. If it's not okay for your neck to look up, you can keep looking down towards the bottom hand. Slowly lower the left hand down, step that front foot back. Take a circle, inhale, and exhale. Opposite way, inhale, and exhale. Take the knees wide, take a seat back towards the heels. Keep the arms outstretched. Soften the forehead down. From your child's pose, come back up onto the knees. And just take a seat down. Take one hand behind, the other to the outside of the opposite leg, and just look over the back shoulder. See if you can really lift and lengthen through the top of the head, and just a gentle look over that back shoulder. If you're feeling any discomfort through the back, again, notice the pelvic tilt. Do you need to draw down, create a bit of length through the back of the body, or do you need to open it up further? Just explore what feels best for you. Opposite side, looking over that back shoulder. And back to the front. Just coming to take a seat now. So similar sort of twist, but just in an easy seat. Maybe you can twist a little bit further. So the twist can come from the pelvis this time. And opposite side, inhale. And exhale. Let's come to lie down on our backs. And I want you to start using this way to get down so that you're not putting any strain through the back. So using the hands to support as you come down and then rolling over onto the back. So when you get up of a morning, when you lie down overnight, use that method of supporting the body with the hands. Bring the feet in so that you can reach the back of the heels. Inhale, press into the feet, lift them up towards the sky. If this is too strong, you can put a block underneath the hips and just keep drawing the knees in. So again, the legs are supporting the back because they're keeping the pelvis stable. And just explore the tilt through the pelvis. So maybe you need to let the bottom sink a little bit, maybe you need to lift it up a little bit. And then exhale, release the body all the way down and take the legs out long. So here, notice there's a big gap underneath your back. See if you can engage through the core muscles and the pelvic floor to tilt the back in. You may need to bring the soles of the feet in to do that. So you can feel the gap and then draw the back in. So this section is engaged and you're kind of hugging baby in towards you. It's not a strong tightening or tensing of those muscles. It's the inner muscles just drawing the tailbone back down. See if you can keep this space here as you inhale and lift up. And then exhale and lower down. And don't let the back find that curve again. So just stop where that curve isn't there. And then inhale to lift up. And exhale to lower down. So keep that core and pelvic floor engaged as you come down. Inhale one more time, up. And exhale, lower down. Let's draw the left leg into the chest. So again, stretching out through those hamstrings, easing some of that back pain, hopefully. Releasing this side, opposite side. Releasing, drawing the knees into the chest and just taking a gentle rock from side to side, drawing down on the tailbone and keeping that core engaged so the back is pressed into the floor. And then release the feet up, find the calves, find the soles of the feet, little rock from side to side. And then from your happy baby, just bring the soles of the feet to the floor and get, again, engaged through that lower back. Rest the hands down and just let the legs fall to the left side on the exhale. And then inhale back through center and exhale them over to the right. So really gentle twist through this back. Inhale up, Exhale over. Inhale up. If it feels good, you can draw down with the top leg to make a bit more space and create a bit of an arch through that back, but only if it feels good. One more time. Exhale over. And inhale up. Exhale over. And inhale up. Let's take the right ankle across the left knee and draw it into the chest. Keep drawing those shoulder blades down, keep the elbows bent. This is like our reverse pigeon. We often do this laying on the leg, but if you've got lower back issues, it can sometimes be a little bit too much. So laying on the back can be a gentler way of doing it. Then release on this side, left ankle across the right knee, draw that leg in. And then simply take the arms above the head, stretch the legs out long, make space through the body. And when you're ready, roll to one side. Slowly come back up to have a seat. So thank you for joining me for this practice today. I hope that your back is feeling maybe a little bit better than it did when you started. If you have any questions about this at all, I have a Facebook group called Yoga Mums. Join that and feel free to ask the group. There's a wealth of knowledge there and I'm happy to answer any questions as well. If you haven't already, subscribe to my YouTube channel so that you get all the videos when they come out. And if you'd like more like this, I've got loads more pregnancy yoga classes, especially those specific ones for specific conditions over in my studio. You can start a free 30-day trial at any time and it's only $14 a month thereafter. So it's pretty much less than a cup of coffee a week. Definitely worth the investment if you're looking to having a calmer birth, an empowered birth, and knowing how to support your body right from early pregnancy to those 40 weeks and beyond. Thanks again for practicing with me, and namaste.